You must have heard of The Elephant Man, a famous story written by Frederick Trevis, made into a film directed by David Lynch.
Have such noble faces.
Yes, I've always thought so myself.
The so-called Elephant Man was indeed a real person named Joseph Merrick who lived in the late 19th century. He apparently suffered from a severely debilitating disease, the exact nature of which has been debated. Some have speculated he had Proteus syndrome. Proteus syndrome is a rare condition characterized by overgrowth of the bones, skin, and other tissues. Organs and tissues affected by the disease grow out of proportion to the rest of the body.
I think is ugly. I was diagnosed with Proteus syndrome when I was around a year old. Proteus is having accelerated or strange growth. So they diagnosed it on the criteria of the kind of tumors that I was growing and the abnormal bone growth that I was having.
The overgrowth is usually asymmetric, which means it affects the right and left sides of the body differently. Newborns with Proteus syndrome have few or no signs of the condition. Overgrowth becomes apparent between the ages of 6 and 18 months and gets more severe with age.
Dr. Guedes needs to do a full physical examination on Wellington.
As manchas aumentaram, né? O inchaço aumentou, ele tem uma perna mais curta que a outra.
Vamos ficar sentado com as pernas para fora. Venha para cá. Se não puser a meia, você não consegue andar.
Não, eu sinto dificuldade. Eu consigo andar, mas eu sinto um cansaço quando eu...
Vamos ficar em pé um pouquinho para mim aqui, não?
Uhum.
Venha. Agora, de costas para mim.
In people with Proteus syndrome, the pattern of overgrowth varies greatly but can affect almost any part of the body. Bones in the limbs, skull, and spine are often affected. The condition can also cause a variety of skin growth, particularly a thick, raised, and deeply grooved lesion. This type of skin growth usually occurs on the soles of the feet and is hardly ever seen in conditions other than Proteus syndrome. Blood vessels and fat can also grow abnormally in Proteus syndrome. Some people with Proteus syndrome have neurological abnormalities, including intellectual disability, seizures, and vision loss. Affected individuals may also have distinctive facial features such as a long face, outside corners of the eyes that point downward, a low nasal bridge with wide nostrils, and an open mouth expression. Other potential complications of Proteus syndrome include an increased risk of developing various types of non-cancerous tumors and a type of blood clot called a deep venous thrombosis, DVT. DVTs occur most often in the deep veins of the legs or arms. If these clots travel through the bloodstream, they can lodge in the lungs and cause a life-threatening complication called a pulmonary embolism, which is a common cause of death in people with Proteus syndrome. Proteus syndrome is a rare condition with an incidence of less than 1 in 1 million people worldwide. Proteus syndrome results from a mutation in the AKT1 gene. This genetic change is not inherited from a parent. It arises randomly in one cell during the earliest stages of development before birth. The AKT1 gene helps regulate cell growth and division and cell death. A mutation in this gene disrupts a cell's ability to regulate its own growth, allowing it to grow and divide abnormally. Is there a treatment for Proteus syndrome? Unfortunately not. There is no cure for Proteus syndrome. Treatment generally focuses on minimizing and managing symptoms. The condition affects many parts of the body, so the sufferer may need treatment from several doctors. Physiotherapy and occupational therapy would be needed in most cases too.